Good morning, good afternoon, good evening, wherever you're joining from. Thanks for joining us. This is the Afternoon Coffee with Legrand show, and we are on episode 6 this week. Again, if you remember, we started this series based on the situation we are in. It's a very interesting times that we live in. We have the pandemic still with us, and it's been a couple of months for some of us that have faced this. And we have a very timely topic today, and it's about how to augment healthcare personnel with technology, with remote monitoring technology for the healthcare industry. And to talk to us about this particular topic, we have two gentlemen joining from the East. And the first one is Hugo Lin. He is our product manager, and he thinks and dreams and works in KVM all day long. This is his baby. He's very passionate about this topic. So I'm very glad to welcome Hugo. Hugo, can we see you? Hope we don't need a wake-up call to get you up.
Yep.
There he is.
Hi.
Hey,
Good
Hugo.
afternoon, everybody.
Sorry to
Good
wake you up
afternoon.
so late.
Yeah, it's midnight here, so very early.
Yeah, so Hugo is joining us from Taiwan, where it's, I believe, 2 a.m. in the morning.
Yes. Yes, it
So
is.
thanks again for joining
Yeah,
us.
no
The
problem. Yeah. I usually stay
yeah,
late.
the second guest we have is somebody you're familiar with, which is Clinton Marshall. He has been in our show before, discussing another topic. So Clinton, oh, there he is. He's joining
Good,
us all the way from
good,
Australia.
good afternoon. I thought this time I'll start in bed rather than upside down.
I was going to ask you, like, what happened to the upside down Clinton from down
Yeah.
under?
Well, I can still be there if you want me to be.
There you are. I remember you mentioned it's very cold for you. I'm sweating here in Sunnyvale. It's really hot today. And so how is
Yeah.
it there?
Well, it's 4 a.m. in the morning, and outside it's still pitch dark and about 2 degrees Celsius.
Wow.
We have no idea what that is in Fahrenheit.
Don't you start at like 17 or something Fahrenheit equals 0 Celsius?
Cold enough.
It's
Yeah.
cold enough.
Cold enough. Thanks again for joining as well, Clinton. So
No problem.
again, today's topic is very timely. So I wanted to talk to you both because you have worked on this, right? You're actually, I should say, you're working on an opportunity right now to help with this situation with a healthcare provider in Asia, in your neighborhood, I mean, in your neck of
Yeah.
the hood. So can you let me start with Hugo
Yep.
to tell us about the environment that we are going into. I mean, we are known for our data center products, whether it's KVM or power strips or power products in general, but this is very different. So help us
Yeah.
understand the environment better.
Right, right. I don't know if you ever go to the hospital, and in the hospital, you when you go to the hospital area, and usually you will see it's very busy. No matter you visit the patient, and you will see like there's like many rooms, like wards, and in the wards there's like many bed, and each bed it has like a many like a life phone support equipment, or like many machines or equipments, and all this equipment is like they will kind of like connect to a server, and it shows like the life form, the vital sign for the patient. So for nurse, they have to from time to time they have to kind of check with every bed in the ward, and they have to make sure the patient status condition is okay. So this usually like it takes a lot of time for the nurse, and they will also cost like their resource like very tight, especially for this like coronavirus and pandemic, and it will kind of like because all the nurse resources like very tight for it. So we know in the hospital, I think how to very like optimistic the like manage or monitor this like the patient status is very important. Yep. So
Thank you. So
yeah.
yeah, so sorry, I was distracted because we had some lawnmower going on outside, so I was getting my kids to close the door.
Okay.
Uh,
Yeah.
so maybe Clinton, you've been in these situations, in these places that Hugo is talking about. Can you help us understand the challenge that the folks are facing in today's environment? I mean, even in a normal day, hospitals are usually very busy, and in this pandemic, I can only imagine like how busy they will be with just few people that they have. So can you help us understand like what is it that they're facing today that brought us into the picture where we are in a position to help with the situation?
Sure, thanks, Jawahar. So I think to paint a picture of the work that we've done with a healthcare provider, they provide the tools to monitor the patients, and the hospitals aren't really doing much different in terms of their staffing and the people and the patients and the care that's needed. But when you have larger wards with more beds and more patients and maybe less staff, you've got an average of 80 beds per hospital that we were working with this particular customer in, where they need to be monitored 24 hours a day. And one thing that we're finding, as with most industries, is IT seems to be coming into the fold. And the challenge is that when you've got healthcare devices now that are capturing data about a patient, these data points are generally feeding back to nurse stations. And these nurse stations are the central point where these alarms need to be prioritized. And sometimes having the right skilled nurses to review that data is a challenge, and especially when you've got an increase of patients, you need to be able to prioritize not just the care for the patient, but also assigning the right nurse or skilled staff member to the to the patient. So the system that is in place within this particular example is using specialist IT hardware, and the challenge is getting access to this hardware, because in hospitals they're generally quite big, sparse places, and with not just one nurse station, you've generally got multiple nurse stations and multiple wards. So the challenge was being able to get access to the different machines that are hooked up to the different patients, and being able to effectively monitor, or more efficiently monitor the patients.
So if I understand it right, like when we've seen these places, it looks like there's a lot of equipment that's within the patient rooms, and then the staff that's monitoring these are sitting outside or maybe in a different area, and it almost seems like they're already connected. They're already monitoring from somewhere else. So what's different now? What is it that I'm missing that's missing in this situation?
It's the fact that these medical devices are now connected to a network, and these networks are typically air-gapped or on a completely isolated network for patient confidentiality and security of data, because this is the most personal data that anyone could get on a particular patient, and that impacts a whole bunch of stuff like insurance and other things that I'm not even going to start talking about. But the point is that the medical landscape is looking more like a computer room or data center. Data centers are starting to sort of encroach into the hospital space because of this specialist IT equipment now requiring servers and storage and data flows to work effectively.
So there's you mentioned air gap. I think what you're talking about is almost like there's a separation of different networks where data can reside and where it can be accessed from. So it looks like these are almost like islands where are isolated, and we are trying to bridge that. The challenge is to bridge that. Am I getting it right?
Yeah, the challenge is, if you've got one section of a hospital that's on a different level, it's going to be on its own network, and that network typically isn't going to be stretched across a wide space. Or if it is, it's going to be hard to access, especially from a relatively insecure area such as a nurse station. With a nurse station being, we generally can walk past a nurse station and see the keyboard and mouse that the nurses are using, and we can see the actual PC or device that they're using to access, patient information. But when you think about how can we walk past a server in a data center, well, generally not. But if we were even the general public going into a hospital, we've potentially the risk is a lot higher. So of getting access to these specialist devices or networks. So they're generally on an air-gapped network, which isolates them from the normal hospital networks. Sort of like having a public and private network. It's just a different network, and the challenge is getting access to those servers and IT devices, or in this case, medical devices that are on that separate network.
On the separate networks. So now that we understand like how the layout is and what they're dealing with, it almost looks like there's a response time involved, right? If you're not in your station, but in a different station, and a patient from your station that you're monitoring has a problem, you may not even know it because these are so isolated and like disparate systems. So in the KVM terminology, we use this term called home run. It almost seems like each room is home run into one system or one station rather than a way to kind of access anything from anywhere.
Yeah, that's right. So you mentioned one thing, which is KVM. So for those who don't know, KVM stands for keyboard, video, and mouse. And home run, as you're referring to, is where you've got, in this example on the screen here, on the right-hand side, you've got an IT device or server or desktop PC that's keyboard, video, and mouse connections are currently connected to the machine with the green dot on the front, and the video monitor at the bottom has that same green dot. But if I needed to access the machine on the left, I'd be able to use a KVM switch, which would just reroute those KVM signals to another machine. So in the hospital environment, you have a KVM switch that's generally in the server room. KVM switches are generally found not just in server rooms, but in data centers, labs, broadcast studios, and many different environments where you might need to share access to the same equipment. So in the medical landscape, if you had dedicated machines on air-gapped networks and you needed to give multiple users or nurses access to those machines, you would have some sort of multi-user KVM switch. I'm trying to keep it as simple and easy to understand as possible, but when you start to look at additional layers of complexity, when you start to add a network, now you start to involve other ways that the users can access the KVM switch, which in turn then accesses the IT devices, or in this case, medical devices. You'll see when I explain the solution that we're not actually connecting to those end medical devices. We're connecting to the servers that are consolidating the medical device information. But I just thought it was important to understand that there are industries, as I mentioned before, like the medical industry, that are transforming to modern technologies, and it's bringing the need for local and remote access by multiple users. And it may not just be nurses in this example, it could also be the IT people or even the manufacturer of these specialist medical devices.
So that's a good distinction to make, because these devices that we're talking about that monitor the patient's health are not computers, but they are connected to some kind of a computer, and those are the ones that are being monitored from elsewhere, whether it's the nurse station or whether it's an IT person coming in to troubleshoot something, for instance. So
that's right.
What are those devices like? Are these generic servers and or computers that we just buy off the shelf? Is that what we deal with?
Well, for this particular example, no, the equipment was already present and installed. The challenge was that the nurse or the IT people would be walking to a separate room and accessing the IT equipment, which would be taking them away from the nurse station or taking them away from their core function. And it was hard to manage. It was wasting time, or it wasn't an efficient way to have to travel from one side of the hospital to the other. So I guess to use it as an IT support example, if you were one IT support person and you needed to travel from level 1 to level 2, and there was a lift in the way, and in current situation only one person's allowed in the lift because of social distancing rules or laws, whatever may be present. It's a hassle to have to walk around and gain access to a computer room or a laboratory to get access to that IT equipment.
And in some cases, you need to wear PPE as well, the personal protection.
That's right. Yeah, correct. Yeah.
Okay, so I think we've set the stage as to what the real, what the environment looks like, what the challenge that we face, that the personnel in this area face. So now let's go into like how we got involved and what we are working on today to solve this challenge or to address this challenge. So maybe I'll start with you, Clinton, and then we can have Hugo expand on it.
Sure. So when we look at the connected solution, so I'm calling it connected solution because really everything is connected these days. So to visualize the setup, if we had the different medical devices, these are connected to that air-gapped network. And that air-gapped network is also connected to the specialist IT hardware that kind of look like servers or PCs. They have some sort of video output, some sort of user interface like a keyboard and mouse. And these medical devices or specialist devices connect to the computer interface modules, or sometimes known as SIMs. And these SIMs come in different flavors depending on the IT device. But basically, with the medical devices, these then connect into a network connected KVM switch. And this KVM switch then connects to the hospital network. So off the hospital network is where you have the different nurse stations. So when you look at a nurse standing at nurse station number 1, they can access any of the outputs of the medical devices from any of the nurse stations, because the common element to all 3 nurse stations in this example is that 1 KVM switch. And that 1 KVM switch is connected to the medical servers that are in turn monitoring multiple medical devices. So this is a kind of an example of how someone that had the challenge of getting access to those medical devices that are on a different network, they're using the KVM switch, I guess, kind of like a jump box in some ways, or a middleman to gain access to the devices on an isolated network somewhere else in the building, or because it's over IP, it could potentially be from anywhere. And one of the things that we found from this project was that the manufacturer also realized that, well, they don't need to travel to the hospital anymore to do diagnostics. They could use the same technology to not only apply and give access to the users within the hospital, but they could give access to themselves remotely via a second network.
There'll be more management network. Okay.
Yeah.
So, I mean, from what I can tell, that looks like a standard KVM switch that we make, the Dominion series. I have the little one here, the smallest one that we made. This is Hugo's baby, so I'll let him talk about it in a sec. But it looks like the generic KVM switch. But so what have we changed to make this work in a hospital environment? Did we change anything, or was it like a plug and play for a hospital environment?
Basically, for a KVM switch, you just saw on the this connection diagram is like a kind of matrix one. So it has like many ports. You connect to a network. You connect to the server. So basically, it's using maybe in the IT environment. But Jawahar, you just show. I also have one sample on my hand. So this is our latest product. It's called KX4101. So it's like a one-port KVM switch. It's over IP and supports like a 4K, and it provides like a very good video, high performance video, and it has like it support like gigabyte network. You can connect to a network here. You can connect to a HDMI port on the here. Oh, sorry, here, and you connect to the PC here. And we also provide a local port. And this is dry contact. You can reset the PC, and you can also connect to some like a signal light for some like a situation identification. So for this like a single port KVM over IP is more flexible, and for the hospital area, because you can connect to like some PCs in the nurse station, in the doctor's office, in the operating room, and also you can put in like a different applications for this like a KX4101. So for a KX4101, it brings you like a very good video. So for the nurse or for a doctor, they can easily to show the video of the like a patient status, or even some like medical information like their report. So I think we have like a different KVM products for the hospital environment. So that's what we do. And the other thing is we also provide some like SDK or API. Maybe Clinton can explain that later. We can have these like SDK software to integrate with some like many hospital management system. So for the IT people, or for the people that use this system, they don't need to learn they don't need to open too many different like software or windows. They can just use like their own management system to kind of like this show, the slideshow on the screen is we integrate with our KVM client with the hospital management system. You can bring this kind of like their heartbeats or their like a pulse, all the information on the screen. So you don't have like open too many like windows on your screen.
That's great. It does look very familiar to the general KVM interface that we're very familiar with, but I do see that it says beds instead of ports.
So for ports, you can name like a different like a bed, or you can name by what you want, right? So in the hospital, you can like name all the ports like bed 1, bed 2, bed 3, so you connect to the server you just saw. And for other, maybe for the manufacturing, it's like machine 1, machine 2, machine 3. So you can kind of like name all the ports, and kind of customize what you want.
So what we're seeing here, it looks like it looks very familiar in another sense. The black screens that we usually see on the monitors within the patient room. So it's almost like a mirror image, right? Like
Yeah.
whatever they see in the hospital room, you can see
Yes,
it.
you can see at the nurse station or even in the doctor's office.
Yeah. So
Yeah.
does that mean like they won't have that screen within the hospital room? Is it just, or do we still see that in the hospital room as well?
I think in the they can see in the hospital room, and they can also see in the nurse station. So both, if the nurse in the ward, they can also see that, and for the nurse station they can also see that, because for KVM we also provide for the local port, for the people, at the bed, they can also see the patient monitor.
So you don't miss anything because you're not because you're there, right? You're going to see that,
Right.
well
Right.
as see from remote. Okay.
Yes.
Great.
Yeah.
So let's expand a little bit on the SDK that you mentioned. Like, how easy is it, or
Right.
who can take that and create something completely custom based on what we provide? How easy
Right.
it is?
I think for the programmer, and they need to have some like a programming skill. For our SDK, we are based on like a Windows .NET framework. So it's written by C#. So for the engineer, they need to have those skills. They need to familiar with these platforms, and they can do some integration. We also have some like a documentation included in the SDK. So I think it's very easy for the user or the IT people. They can integrate to their own system.
Okay, great. So I think that's let's see, quick time check. We have 3 minutes left, and I just checked the questions. I have just one comment, but other than that, if there are any questions, please feel free to type them in as we wrap this up. And so, Clinton, I was worried like if you went to sleep soon.
No. I made my 4 a.m. coffee. That's okay. It's doing its job.
Nice.
Yeah, that's
4
nice.
a.m. That's pretty early. How about you, Hugo? How did you stay awake?
I try to focus on what I'm going to say. So I'm a little bit sleepy because it's almost 2:30. Yeah, so I think 3 a.m. is my limit.
I know it was also your off week, so you're off the whole week. So
Yeah,
thanks
I
again.
can sleep the whole day today. Yeah, no problem. Yeah.
Yeah, so I don't see any other questions. So I would just take this chance to thank you both for joining at such late hours, and staying awake and being so clear.
Yeah.
I don't know how you did it, but
Yeah, I have
again,
my midnight coffee here.
we all need that. Yeah. So thanks again for joining.
Okay. Thank you. Have a great day.
And everybody on the call, thank you for joining us.
Thank
Next
you.
week, we have another great session with Andy Cranston. He's going to talk about, again, just like what Hugo said, scripting, but on the Power products. So hope you can join us, and stay safe.
Yeah. Thank you.
See you.
Have a great day.